And welcome. It's July 2nd, 2024. We are performing the Deuk laser disc repair on a patient who has horrible back pain, AP. He's got two problems. The L5-S1 disc is causing back pain. The facet joints at L4-5, L5-S1 are causing back pain. He also has some other things like spondylolisthesis, which is occurring at L5-S1. And we're going to have to make our way down to the L5-S1 and try to fix the damaged disc. How is he doing, doctor? Okay. Shot, AP?
How you doing, buddy? You all right?
Now, a fusion would be another option. He didn't want a fusion. I don't blame him. So we're going to try to fix this without a fusion. May need the longer needle. How is he? Is he reliable?
You okay, my friend?
AP?
Doing all right?
No worries. If we need to, we can start with the DPR. Wow. Incredible, huh? Look at that. What? I'm so close, it's hard to say. I think we're okay though. I think we're in a good spot. Should I wait for the reliability?
How you doing, my friend? You okay?
Let's go AP. We're going to do the DPR while we're waiting.
Huh? All right, he's waking up nicely. Yeah, he's waking up.
Is he ready?
Yeah.
Shot?
We're going to ask you, are you having any back pain? No. Are you having any leg pain? What's that?
That should wake him up a little bit. So, DPR or DLDR? Okay. All right.
Okay, we're going to ask you some questions. Don't move your hands so much, okay? Your hands, just try to keep them inside the ride. How are you doing, all right? You're doing good? Okay.
I think that I can feel the herniation. It's huge. Where do you feel that?
Where do you feel the pain? Where do you feel that? In your back?
Shot. Where do you feel that?
Where are you feeling that? Back or leg? Say, your right back is right back.
Shot. All right. Well, this is a level 10. This is harder to get. I think we're going to be okay. Let's see. You're doing great. Just lay still. He's taking the full needle. Shot. Where do you feel that?
Where are you feeling that pain? Right where he's poking?
Shot.
Right where you're working.
All right. Well, that is 5-1.
Try not to move so much. Just keep your hands.
Lay still. You're doing great. Is that where you have your pain?
Yes, sir.
Normally?
Right there, he said.
I think we're partially in the disc. Let's see. You have any pain right now? Shot. And let's hope we're in. Any pain? All right. Is that where you get your pain?
Said yes.
All right. I'm going to try one more little thing, and then if not, we'll put him to sleep because I think we're good enough to get it done. I'm just trying to Let's see if I can get this in. If I can get the guide wire in just a tiny bit more into the disc, then I can slide the needle over it. He's got a bunch of arthritis here. Henry, let's show our audience, how is it these discs become so painful? Sean? Hold on now. Well, I think I'm okay, doctor.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
All right, welcome back. You can see from our video that patients get pain from a disc because of a tear in the back of the disc called the annular tear. And it's not just a tear that causes the pain, it's inflammation that happens in that tear. This patient is no exception. He also has what's called spondylolisthesis, which is a slippage of one bone on another. It's due to a pars defect, which is where the pars that connects pedicle of L5 down to the pedicle of S1 is broken. Shot, that's it. And you can see the slippage of the bone. It's called a grade 1 slip, about 25%. It's on the border of being a grade 2. Long story short, he doesn't want open back surgery. Shot? So the only alternative would be to do endoscopic, because any other type of surgery like laminectomy, discectomy would destabilize the spine even more, and it would cause the slip to get worse. So we are doing the least invasive treatment that we could possibly do to correct his symptoms without actually doing open back surgery. Procedure is called the Deuk laser disc repair. And Henry, let's show the audience how this procedure works. Shot?
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. Good news, we've been able to successfully get into the tear and herniation at the back of the L5-S1 disc. We now have our endoscopic tube in place. We've only lost a few drops of blood, and I feel really good about this surgery. Our patient's asleep. He's comfortable. My anesthesiologist is comfortable. And that's all that matters. So we're gonna head down the tube with the endoscope, and we're gonna see a herniation down here at L5-S1. Let's hope we can get this fixed for the patient. Unfortunately, most surgeons don't know how to do this type of surgery, which is not good for patients. Instead, they just know how to do fusions. And most surgeons will just recommend a fusion because, well, that's what they're taught to do. But there are newer technologies and techniques available now that don't involve fusion. that are better than fusion. This is one of them. It's called the Deuk laser disc repair. It relies on two new technologies. One is laser, the other one is endoscopic surgery. Compared to old-fashioned surgery, which is done with metal instruments and big incisions, this is newer, more advanced, less invasive. No. Wait, you're pulling my finger. All right. Here's the area causing all the pain. You see the red inflammatory tissue?
Yes, we do.
I need a big one. 1,000.
Oh boy, Luis. Huh. Bit sloppy, right? I think you need to be poking your head in a little more, inspecting what's happening, so you can resolve some of these issues. I don't know what's going on. The scope is a little bit blurry. Some of that is due to bleeding.
1,000. 1,000. I need a big one. So try to see the number. You can clear it.
Any questions from the audience?
Yes, we have a question from the classic Car Nut on YouTube
All right.
asking, how can you be certain that you don't remove healthy tissue in the process of the surgery?
How can you be certain you don't remove healthy tissue? The answer is you can see the tissue with your eyes right here. You can see what's healthy, what's not healthy. And the second reason is we are entering the disc right where the unhealthy tissue is. So think about it this way. If Russia is fighting with Ukraine, and Russia bombs Kiev and destroys Kiev, okay, the city of Kiev, and you want to go into Ukraine with an army, but you don't want to ruin any of the beautiful Ukrainian country, then you would go in through Kiev because it's already been destroyed. So you go into the area that's already been destroyed. It's the same thing we're doing here. We're going into the spine in an area that's already been destroyed. That's the annular tear and herniation. So we're entering exactly in the best spot for the patient for us to enter. The area where the herniation and damage has already been done. You can't really make more damage in an area that's already damaged. So that's how. I'm getting a lot of water on my shoe from my wrist down. So two reasons. One, we're entering the damaged part of the disc, and that's the only place we're entering. He's wiggling around a little bit. Two, we can see what we're doing with the endoscope. Yeah, he's responding a little bit. It's not much, and you're welcome to keep him where he is. It's up to you, but I'm just making you aware. Luis,
Yes, sir.
the scope.
What happened?
It's just, I don't know. I mean, some of it's just blood. Have you shown our audience the 30 causes yet?
No, not yet.
Let's do that.
Copy that.
I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majin. Thanks for joining us. No? Bring Jordan back. All right. You can see from our video there's about 30 different things that cause back pain. The most common is the disc, and that's what we're fixing right now. Is that sterile?
We already opened for the next case.
Uh-huh. So what we're going to use for the next case?
We're gonna prepare right now.
Jordan, can you be ready to bring the fluoro in? We're almost ready for you on the DPR. Push it in. Should already be. I already opened it enough for that. Unless the base is different. Any questions from our audience?
At this moment, no current questions, but we do have a comment.
Where is the irrigation? God damn it. Go ahead.
This comment coming from Daniel on Facebook saying, El Maestro Dr. Deuk.
Ah, Daniel, thank you. Laser. Appreciate it. Vote of confidence. Doing our best here. Truth is, these surgeries are not that difficult if you know what you're doing. And the good news is, we've been doing this for so long, we kind of figured out what needs to be done. But thank you for the comment. And I will say that my team does make me look really good most of the time. So couldn't do it without them. Yeah, they go unappreciated. We do have a huge team here of people that help take care of the patients. What is it?
Just getting some sun.
All right. Just about done. You can see that inflamed area up there. This is the last of the herniation here that I can get. Now, part of the nerve compression here is really from the slippage, and the other part is from the pinched nerve from the herniation. So there's more than one thing causing the pinched nerve here. I'm working laterally here in the foramen at this time. I've already worked medially towards the midline. Now I'm heading out towards the outside of the foramen. You can see a lot of scar tissue there, some calcium deposits. But overall, I'm pretty happy with the results. Remember, we will never get rid of 100% of the herniation. It's not possible. And my goal is to get rid of as much as I can safely. If I can get 50%, I think that's a good result. Generally, with 50% of the herniation being removed, patient symptoms go away, stay away, don't come back. All right, after we're done here, we're going to move on to the Deuk plasma rhizotomy for his facet pain. And I'm going to do that next. Any questions from the audience?
At this moment, no current questions.
We do have one more surgery today. Our last surgery for the day will be a patient who also has disc pain, but also piriformis. And we're going to go in and release the piriformis muscle. Isn't that correct, guys? As well as repair some disc. I need another minute and we're done with this disc. Any other questions, Henry?
At this moment, no current questions.
All right. I've done as much as I can. You can see the nerve there. It's angry, inflamed from getting pinched for so long. Hopefully it's going to settle down. and cool off over the next 12 months.
Lights on, please.
All right, so we're gonna wrap up the DLDR and move on to the DPR right L4-5. Jordan, you ready? This is clogged, I think. I'm sorry. This is totally clogged. Yeah, because it's so much arthritis, hard stuff down there, just clogged up the channels, which not the end of the world, but better if we don't have to put it back in like that. All right, done. I'm pulling this out. Not an easy case, very difficult. Level 8 out of 10. Big guy, deep back, slippage, bad arthritis, collapsed disc, big facets, little rotation. Take this out of here, please. We still have his facets to do. We're going to do those next. Do you have a stapler? I'm going to staple his incision closed.
Okay, you can grab the camera on the light, please. Thank you.
All right, now we're going to perform the Deuk plasma rhizotomy shot. Yep, shot. Good. So there, I get CL4 down below, right, Jordan? Not the one below me, but down there. 4. I can't see 5. Do you see 5? And do you see S1? Let's get the lights down a little bit. It's too bright. Incision. All right, so we're going straight into the Deuk plasma rhizotomy. This is a procedure we do to treat facet pain here in this particular patient. He has both disc and facet pain. Shot. Come on, Jordan. Let me know when you're ready, Jordan. What's the issue here? Sorry, we're...
I know what it is. Jordan, remember when we attacked her? So anyone, yeah, great. I'm going to move the...
Just let me have that first so I can see what I'm doing. Open it up, please. Shot. Go ahead and fix what you need to fix.
What is going to turn off the bulb? That's the problem.
Shot. Go ahead, turn off the bovie. Sorry, Henry. You lost our signal.
It's all good.
Can we get this issue fixed permanently so it's not a recurring issue, guys? All right, let's go back to the fluoro as it is. Shot. Sorry folks, we're not going to be able to show you the x-ray views, but you can listen in. The reason is we have a connection issue between our fluoro machine and the broadcast equipment. Shot. Oh, it's there now? How do we fix it? Shot? Can we not make that happen next time? Shot? All right, perfect. I'm on the transverse process at L5. I'm doing the Deuk spine slide or shuffle. Shot. That's really nice. I need to see the sacrum. And yeah, you might have to turn that just a little bit.
Almost done?
Yeah, 30 seconds maybe, shot. What do you think it is, Jordan, right there? Shot. I agree with you. Shot. Shot. Oh yeah, it's the perfect spot. Hopefully we got the pain nerve taken care of. Good job, everybody. Thank you very much. We will be back for one more case. But I think that's going to help him quite a bit. Thanks, Henry.
Not a problem.